Hello everyone, my name is Baneet Kodang. Today we are going to discuss about a case study on mental health on issues and concerns of drug addiction. In this case study, our group is assigned with a case scenario about a pregnant woman who is using opioids and falling in sex trade to support her addiction. What are the objectives of this case study? First of all, we will define the term addiction, and then what are the local statistics and case scenario of this case study, then what are the social determinants and barriers the lady faces, and what are the challenges faced by the lady and the plan of care provided by the nurse, what are the legislation and the assessment provided by the nurse to that lady, and what are the and we will identify the available resources, and then conclusion. So what is addiction? As per American Psychiatric Association, addiction is a complex condition, a brain disease that is manifested by compulsive substance use despite harmful consequence. Then addiction, it affects the physical, psychological and social conditions of an individual. It means it changes the behavior of an individual, and then it can cause harmful changes in how the brain functions. Addiction leading cause of preventable illness and premature death. According to the National Institute on Drug Abuse, people start taking drugs for following reasons: to have feeling of pleasure, to feel better or to relieve stress, to improve performance, curiosity and peer pressure. So what is opioid? Opioid is a drug which is used to relieve pain. As per Center for Disease Control and Prevention, opioid use disorder is defined as opioid use disorder, sometimes referred to as opioid addiction, is a problematic factor of opioid use that causes significant impairment or distress. Opioid exposure during pregnancy. Opioids use during pregnancy cause risk for mothers and babies. Pregnant women with opioid use disorder may suffer from co-occurring mental health condition, particularly depression. Opioid, when used during pregnancy, might cross the placenta and enter the fetal central nervous system. So what are the effects of opioids on babies? Poor fetal growth, preterm birth, stillbirth, specific birth defects, neonatal abstinence syndrome.
Hello everyone, my name is Sharon Pereira. I am here to present the topics of statistics and the case scenario. Substance use is quite common on an international scale and statistics vary depending on the substance being consumed. It is estimated that nearly 5% of the world population have used an illicit substance. 240 million people around the world use alcohol problematically, and approximately 15 million people use injection drugs. In Canada, it is estimated that approximately 21% of the population will meet the criteria for addiction in their lifetime. Alcohol was the most common substance for which people met the criteria for addiction at 18%. Cannabis has one of the highest rates of cannabis use in the world, with more than 40% of Canadians having used cannabis in their lifetime and 10% having used it in the past year. In Ontario, it is estimated that approximately 10% of the population use substance problematically. Recently, Ontario has seen a growing trend of harms related to opioid use. In 2016, there were 865 deaths due to this substance, equal to an opioid related to overdose death occurring in Ontario every 10 hours. And coming to the case scenario, our group has been assigned to conduct a prenatal class in Cabbagetown, St. Jamestown, as a part of the community health promotion. The class was organized in multiple locations within Cabbagetown to St. Jamestown. The class was conducted at no charge, offering education, information, advice, and support to pregnant women. On the third day, the class was held in Wellesley Community Center located in St. Jamestown. There were a group of 22 women attended the class. At the end of the class, all the attendees were given a chance to share their concerns regarding the pregnancy in person. I noticed one of the attendees, her name was Hannah, 25 years old, and is in the first trimester. She looks beautiful but dressed inappropriately. She was slim, tall, and wore a tweeted coat and blue jeans torn at the knee. She looks pale and malnourished. She was introvert at the beginning, and I understand she had some psychosocial problems. I tried to maintain a good nurse-client relationship and by assuring that if she has any problems other than pregnancy, we are there to help and support her. After gaining her trust, I asked her background. She was an adopted daughter and her parents brought up very well. But by the age of 20, she had an affair with a widowed man on his 40s. She dropped out college and moved into his place after 6 months of relationship. But she couldn't tolerate his physical abuse, so she moved out. She couldn't go back to her parents and eventually ended up in using street opioids such as heroin. She first began snorting the drug and then began intravenous injection. She worked as a bar girl for a while for her daily living, but she couldn't work longer because she got expelled out of work due to her stealing habit. Later, she turned into prostitution to earn some income primarily to purchase drugs from the drug dealers. Because of not paying the rent for several months, she got eviction notice and has to move out from the apartment. She shared a room with a guy who was her boyfriend for a short period. Her boyfriend too was a drug addict. Unfortunately, she ended up the relationship with her boyfriend after being together only for a couple of months. She cannot get into relationship because she said it is hard for her to coordinate and understand emotions. By this time, Hannah became homeless. She said that if she had completed her studies, she would get a decent job. She told she had mood swings, sometimes feel high, physical agitation, and having craving for drugs. She now developed some physical problems such as muscle cramps, restlessness, muscle tensions, nausea, and drowsiness. She was encouraged to attend the class by one of the community health worker in the area. She attended the prenatal class as she is anxious about the baby and her health. She said she tried hard to quit the drug usage, but she couldn't overcome it alone. She really doesn't know what to do and where to go. She really wishes to lead a good life with her baby. Intervention plan was designed to help the client to resolve the addiction problem she is facing and to aid the natural process of pregnancy and to develop a positive self-concept. The treatment goal was to stabilize Hannah on a steady dose of methadone and to transfer her to an outpatient methadone clinic. We referred her to the social worker in the community and gave all the guidance to the available resources within the area. Thank you so much.
Hello everyone, my name is John Brian Federico, and the topic that was assigned to me is social determinants of health and barriers to accessing healthcare services. So our case scenario is about a 25-year-old woman who accessed our prenatal class. She disclosed that she has been using opioids and works in sex trade to support her addiction. So the social determinants of health that is related to our case scenario is food insecurity. Without a permanent job, the patient cannot support her daily nutritional needs, especially in the situation that she is expecting a baby. Education and literacy. Patient drop out of school after having an affair with a 40-year-old man. Patient says that if only she finishes her studies, she can get a decent job. Social support network. Having someone to be with you in times of problem helps a person to solve their problem easily. The patient doesn't have friends to help her. She wants to go back to her parents, but afraid that they will not accept her. The patient ended up leaving to people she doesn't know just to have a place to stay to. Income and social status. The patient got fired from her previous job and ended up prostitution. Patient doesn't have a regular income to support her daily living in her pregnancy. Social environment. Patient lives with a 40-year-old man who was abusing her physically. She ended up in the street using opioids. She then got another boyfriend who is a drug addict too. After getting fired from previous job, patient do prostitution just to support her drug addiction. After a couple of months of not paying her rent, patient got evicted in her apartment and now living in the street. Barriers to accessing healthcare services. So, lack of familiarity with the Canadian healthcare system. So, patient doesn't know how to access healthcare. She was only invited, that's why she was there in our program. Patient wants to stop the use of illegal drugs but doesn't know where to start or who to ask for help until she came into our class. Also, patient has zero knowledge about pregnancy. Next is social environment. So the patient is too shy to tell her stories because she is scared that everybody will judge her situation. Next is stigma, treatment costs, perceived absence of problem, and time complete. So those are the social determinants of health and barriers to accessing healthcare services that is related to our case scenario. Thank you.
Hi everyone, my name is Cherry Mota. Today I will discuss the challenges faced in the plan of care about opioid addiction of 25 years old pregnant women who attended our prenatal class. She is a user of straight opioid and works in a sixth trade to support her addiction. According to Centers for Disease Control and Prevention, opioid use during pregnancy can affect women and their babies. Opioid exposure during pregnancy has been linked to some adverse health effect for both mothers and their babies. As an example for mothers, opioid use disorder has been linked to maternal death. For babies, opioid use disorder or long-term opioid use has been linked to poor fetal growth, preterm birth, stillbirth, specific birth defects, and neonatal abstinence syndromes. The challenges that Hannah is facing is first, she is in her first trimester of pregnancy. She doesn't have friends to help her. She could not go back to her parents and eventually end up using street opioids. She got evicted and must move out from the apartment. She became homeless. She was depressed, guilty, and wants to stop using the drugs. She is worried about her babies and wants to go back to her parents. Diagnosis and treatment. According to Center for Addiction and Mental Health, methadone and buprenorphine are opioid medication that do not cause intoxication at the correct doses. When they are prescribed, they eliminate persons' withdrawal symptoms, which may help them stabilize their life. Two main treatment for opioid addiction. Opioid agonist therapies using methadone or buprenorphine. Number two, addiction treatment counseling like withdrawal management, day treatment, mutual aid groups such as Narcotic Anonymous. Treatment for opioid use disorder before, during, and after pregnancy. Number one, suddenly stopping opioids during pregnancy is not recommended as it can have serious consequences including preterm labor, fetal distress, or miscarriage. Number two, current clinical recommendation external icon for pregnant women with opioid use disorder include medication-assisted treatment. Number three, it is important to recognize that neonatal abstinence syndrome is an expected condition that can follow exposure to medication-assisted treatment. Number four, close collaboration with the pediatric care team can help ensure that the infants born to women who use opioids during pregnancy are monitored for neonatal abstinence syndromes and receive appropriate treatment as well as be linked to needed services. Number five, women with opioid use disorder during pregnancy should continue medication-assisted treatment as prescribed in the postpartum period. Thank you.
My name is Tenzin Sonambutia. The topics I will be talking about the legislation and the nursing consideration. Mental health and addiction legislation. First Act, the Ontario Mental Health Act. The Mental Health Act sets out the powers and the obligation of psychiatric facilities in Ontario. It governs the admission process, the different patient admission, as well as directive around assessment, care, and the treatment. Second Act, Criminal Code of Canada. Mental disorder is a section of criminal code which addresses the criminal liability of accused person affected by a mental disorders in a commission of criminal offense. Third Act. Controlled Drugs and the Substance Act. Controlled Drugs and the Substance Act is a federal statute for the regulation of certain drugs and substances and their precursor. It contains schedules which categorize the various drugs and narcotics. Fourth Act. The Canadian Human Rights Act. The Act prohibited discrimination related to pregnancy such as negative refusal to hire or promote, termination of employment or harassment are against the law under Act. Nursing consideration. Some of the nursing assessment and the consideration in managing heinous situation are as follows. Screening for the patient. Assess the patient behavior, attitudes, problem and the needs. Routine pregnancy care may benefit from more frequent prenatal care visit. Guidelines for the antenatal testing, monthly ultrasound assessment. Nutrition for the patient. Note total daily calories intake and maintain diary of intake. Consult with the dietitian and monitoring weight weekly. Patient provider report. Open and honest communication about regular health care during pregnancy. Maintain confidentiality of her information and identity. Never use judgmental language and approach in non-judgmental manner. Establish trust and report since the victim may have trust issues with patient. Keep your relationship with client as a professional. Risk for the infection disease. All opioid women should screen for the infection disease, including the HIV, HCV, and other sexually transmitted infections. Teach health promotion and healthy practice that avoid further transmission. Counsel on benefit of teaching, testing and educating on how to reduce exposure and its transmission. Social stressor. Screening for the safe and supportive living environment should be performed. Women who do not have a drug-free living environment should be prefer social services and safe housing.
Hi everyone, I am Steffi George and now we're going to talk about available resources. Number one is Sherborne Health. They work closely with their partners and community members. Their primary healthcare and chronic disease management services, health promotion and education, outreach and social support, and mental health services work together to provide transformative care and support. Another resource she can access is All of You Wellness Center. At All of You, they believe that wellness includes the whole person, beginning with mental health. The third resource she can access is Mental Health and Addiction Services. It has got two options. One is Residential Withdrawal Management Service. These are places of rest and recovery that is staffed by sensitive, respectful and well-trained professionals to support clients through their withdrawal process. The second one is Women Health Program and Focus Areas. The St. Michael's Obstetrics and Gynecology Department is a part of the Inner City Health Program. Another resource she can access is Straight Haven. It has got two options. One is In Residence Program Grand House. Straight Haven Addiction Service provides a 3-month intensive treatment program for women who experience challenges associated with substance dependency. The second one is Community Outreach Addiction Services. It is a harm reduction based community program available for women who are leaving the in-residence program and to other women living in the community who need support, resources, counseling and help with life planning. Another resource she can access is MMT Downtown. MMT Downtown is an addiction treatment center and pharmacy in Toronto. They provide a wide range of professional services to meet your needs. Another resource is Pharma Docs Downtown Methadone Suboxone Clinic. Alcohol detox and withdrawal program. They focus on providing personalized methadone treatment for each client. In each program, experts work with clients to address root cause of substance abuse, coping mechanisms, and tools for building a lifestyle to avoid relapse. Robertson House. Robertson House is a shelter home for pregnant women and women with children in need of short-term emergency shelter. So these are the resources that she can access. So we are done with our available resources. So to conclude, addiction is considered as a very serious problem affecting all types of people around us. Dealing with substance abuse or drug addiction is never easy
and it is even more difficult when you are struggling with mental health problems. In Hannah's case, as she had approached our prenatal classes, she can be guided to de-addiction centers, shelter homes, and other women health centers. This can help to protect and safeguard herself and her unborn baby. With the right support, self-help, and treatment, everyone can overcome a co-occurring disorder, reclaim your sense of self, and get your life back on track. Thank you very much.